In the field of medicine, there is a disease known as renal insufficiency. Most people commonly refer to it as weak kidneys. This term basically describes a situation where the kidney is no longer able to work correctly or perform its essential functions. But were you aware that there are various symptoms that the body develops specifically because of these weak kidneys? Today, I am going to explain to you what the functions of the kidney are, what the symptoms of weak kidneys look like, and what a person should do when they realize they are experiencing these symptoms. I will tell you in advance that the very first thing you must do, everyone, is run to the doctor. There is no such thing as a miracle tea or a miracle medicine to treat this specific problem. You absolutely have to see a medical professional so they can discover exactly what is happening with your kidney. However, I will provide some tips for you to prevent your kidneys from becoming weak in the first place. So, what exactly is the purpose of our kidneys? They have many functions. And while I have discussed this before several times, I will summarize it so you can understand. Our kidneys are capable of filtering the blood, removing things that the body no longer needs. Everything that is considered waste or dirt in the blood, our kidneys have the capacity to eliminate. Furthermore, they are extremely important for controlling our blood pressure. That is right. If the kidney is functioning well, it keeps the pressure at stable levels. If the kidney stops working, as is the case with weak kidneys or renal insufficiency, then the pressure begins to become unregulated, and normally it ends up increasing significantly. The kidney is also very important in the production of hormones because it produces certain types of hormones to maintain good function throughout the entire body. There is a hormone called vitamin D, and specifically, its full name is 1,25-dihydroxyvitamin D. This is a very complex name, so let's just call it vitamin D. The kidney produces this hormone, and this vitamin is very important for the intestine to absorb more calcium. For those of you who drink a lot of milk or take calcium supplements to replenish bone calcium, if your kidney is not working, your intestine will not absorb it. Consequently, you will have bone problems, such as osteoporosis. Therefore, the kidney is very important for this as well. What exactly is renal insufficiency? It is nothing more than a condition or a disease where the patient can no longer perform the functions of the kidney. They can no longer filter the blood or produce the hormones they should. The kidney loses the function of controlling arterial pressure, and all of this ends up being compromised. When our body cannot perform its functions in one organ, the entire body begins to suffer. Renal insufficiency can be of two types. It can be acute renal insufficiency or chronic renal insufficiency. Acute is when a very fast disease happens in the kidney, generating insufficiency and making it weak very quickly. Chronic is because for a long time, many weeks, months, and years, your kidney was suffering. It suffered because you didn't drink water, for example, or because you only drank soda. After suffering, it died slowly, and then it reached a phase of life where the kidney no longer has function, and we enter a state of weak kidneys. A question many people ask is, can renal insufficiency be reversed? Acute renal insufficiency can be reversed. If the patient entered an acute state from a fast disease that affected the kidney, there is a way to reverse that situation. However, if the patient is in chronic renal insufficiency, there is nothing left to do. Our kidney does not regenerate. You know how your skin, when you cut it, leaves a small mark for a while, but then returns to normal, and sometimes you can't even see the scar? That does not happen in the kidney. Once it is injured and loses function, that's it. It will not regenerate like skin or some other organs. This is very dangerous because when the kidney has been lesioned for a long time, it will remain insufficient. The patient has nothing else to do if they don't take care. There is a chance of needing hemodialysis in the future, which is something many patients do not want to reach. This involves the patient lying down for several hours a day, with cables connected to the veins and arteries in their arm, with a machine doing the role of the kidney, filtering the blood and returning it. What are the causes of a renal lesion that makes it weak? If a patient takes too many anti-inflammatories, that is a very common cause. It is one of the main causes of patients appearing with weak kidneys. People exaggerate with ibuprofen, paracetamol, nimesulide. They overdo these anti-inflammatory medications. You cannot exaggerate. Some people feel a little headache and take it, or they go to the gym and feel muscle pain and take it. You can't do that. It hurts the kidney and leaves it weak. You could end your kidney function in a few years. Another important factor is smoking. People who smoke a lot, whether actively or passively by inhaling someone else's smoke, can lesion the kidney easily. Diabetic patients have a higher chance of having weak kidneys, as do patients with high blood pressure or very high cholesterol. High cholesterol can form a fat plaque in the vessel that reaches the kidney, the renal artery. If a plaque closes this vessel, the kidney won't have nutrients, so it suffers over time and becomes very weak. Patients who drink little water end up forming kidney stones, which also increases the chance of renal insufficiency, usually called post-renal insufficiency, because the stone forms in the urinary tract after the kidney. These stones end up lesioning the kidney, and that is dangerous. Usually, this falls under acute insufficiency, because if you eliminate the stone, the kidney returns to normal. However, patients who had many stones throughout their lives mean they aren't drinking water, so the kidney will suffer from all that time without proper water consumption. Infections are also important risk factors. Urinary tract infections happen a lot in women. The infection can go up from the bladder to the kidney. When it infects the kidney, there are high chances of the organ being lesioned and leading to insufficiency. What are the symptoms of weak kidneys? There are several. One is the appearance of something that looks like varicose veins on the leg, but it can also appear on the arms, abdomen, and chest. It looks like purple, pink, and white spots across the skin forming something like webs. The name for this is livedo reticularis. It is a very characteristic symptom of someone whose kidney is suffering to do its job because it is very weak. It also has a strong relationship with high cholesterol in the blood. If you have these web-like spots, go to the doctor because there is likely a problem in your renal region or your cholesterol. Changes in urine are also very frequent symptoms. Some patients start urinating a lot, which we call polyuria. They urinate much more than normal without drinking 4 liters of water. Other patients start urinating very little, called oliguria. Patients in the final stages enter a state of anuria, where they produce almost no urine. Some patients have a lot of foam in their urine, which means it is full of protein. We shouldn't lose much protein through urine. As I mentioned, the kidney is important for blood pressure, so when it is weak, pressure increases a lot and the patient can't control it with medication. Uncontrolled high blood pressure is a major sign. Other things that happen are cramps, usually in the legs or arms. Facial cramps only appear in severe cases when the kidney has failed totally. We also can't forget skin lesions like small ulcers. This is because the body is accumulating waste that the kidney should have eliminated. When these toxic substances accumulate, they can go to the skin and cause ulcers. Swelling, known as edema, is also characteristic. It usually happens first in the legs and feet. In some diseases, especially in children, the face can also become very swollen. Weak kidneys are not exclusive to the elderly. They can happen in children in acute cases. What can we do to take care of the kidney and check if it is working correctly? There are tests like urine type 1, which shows the color, crystals, and if there are bacteria. There is also urea and creatinine, which are substances that must be eliminated by the kidney. If these are high in a blood test, it means the kidney isn't eliminating them. There is also a 24-hour urine test to measure things like protein. Normally, the kidney should eliminate less than 150 milligrams or 300 milligrams of protein. More than that means it's functioning incorrectly, which causes the foamy urine. To avoid having a weak kidney, you must drink a lot of water and avoid anti-inflammatories. If you have high blood pressure, keep it controlled with proper treatment, food, and exercise. The same goes for diabetics. Keep it controlled, use your medication or insulin at the right time, and eat properly. If you have high cholesterol, keep it controlled and avoid fatty foods and fried foods. If you do these things correctly throughout your life, you will reach the end of your life with a functional kidney that keeps you healthy. I hope you enjoyed this video explaining weak kidneys. If this information changed the way you look at the vital organs inside your body, please subscribe and like the channel. We are uncovering the health history that often goes unnoticed. Plant the seeds for your future health. The next treasure of knowledge will be opened soon.